Let's remind you that we're coming to you live from the Knutsford Court Hotel. This is the venue for this One Love, One Heart program, which is organized by JAHJAH, that's the Jamaicans Abroad Helping Jamaicans at Home Foundation, in partnership with Team Jamaica Bickle, the Intersecondary School Sports Association, ISA, and the Jamaica International Female Football Development. All a part of Mission 2015, Mission for Change 2015. And joining me now is the founder and CEO of JAHJAH Foundation, Dr. Trevor Dixon. How are you, sir?
I'm fine, thank you, Dervan. Thank you for having me here.
Good. And we made reference earlier on in conversation with Irwine, Clare, that one of the lead doctors here is from Barbados, Dr. Trevor Atherley, cardiologist at Newark Beth Israel in New Jersey, Caribbean Medical Mission board member, and Joint Forces supporter, volunteer, the whole works. Dr. Atherley, how are you?
Very well, thank you.
Great. Here. Thank you so much for joining us. First up, Dr. Trevor Dixon, remind us of what prompted the establishment of JAHJAH.
Well, JAHJAH Foundation came out of the fact that we were doing work in Jamaica for many years before we formed the foundation, and we just saw that we needed to be official because we saw that there was many needs within the public health system, and we needed the support of not only Jamaicans in Jamaica, but we needed Jamaicans abroad to step up. And we've had what's called a brain drain, where a lot of us leave this island, we're successful, and we go and we have better economic ties in the United States, Great Britain, and Canada mainly. And we said it's time that we look back over our shoulder and remember this is where we came, this is where our roots are, this is where our foundation is. So it was natural that JAHJAH Foundation means Jamaicans Abroad Helping Jamaicans at Home Foundation. And don't forget the foundation. A tree without its foundation firmly planted shall wither away.
That's right. And so now your annual missions would have started when? When did you have that really first official mission to Jamaica?
Well, it's kind of hard to say when I first started because the first mission started with Dr. Hugh Wong and myself at the Kingston Public Hospital, where we just sat down together like two human beings and said, how can we help Jamaica public health system? And that's where the JAHJAH Foundation really officially started, unofficially started, but we gave it an official kickoff in about 2011, where we had our first fundraiser in Hackensack, New Jersey, in a very small restaurant. And once I saw the response of the people, good-hearted people in the United States, and they were not only Jamaicans. Most of these people were from other islands, Philippines and other workers that I work with at New York Beth Israel Medical Center. And I said, wow, if we can have as many Jamaicans here as we have as pen relays, what a difference we would make in the world. So it was kind of ironic that Irwine Clare from Team Jamaica Bickle and I would become very closely bonded. And it's just kind of a divine intervention how we work together in Jamaica.
And you've managed to convince, and I'm not sure how hard it was to convince Dr. Atherley. I suspect it might have been very easy. Not just Jamaicans, but non-Jamaicans alike to come on board and support the efforts of JAHJAH Foundation.
Absolutely not. I met Dr. Atherley in passing when we were working together at Beth Israel in New Jersey. And I didn't realize he had such close ties to Jamaica, which is natural. So, I mean, Barbadians and Jamaica, we have a natural bond. If we can convince our friends in Barbados that bond has been around for a long time, we would do ourselves well.
Yes, and they wouldn't worry about the naming of that stadium, the Usain Bolt Stadium. Dr. Atherley, how are you?
I'm very well, thank you. It certainly is a pleasure to be here. I do have an affinity with Jamaica. I'm Jamaicans. I'm not going to go into all the personal aspects, but I am married to a Jamaican. And I did train here. The best years of my training and education were in medicine at the University of West Indies on the Warner campus. So clearly I'm back home again. But over and above that though, I am a member representing the Caribbean Medical Mission. That's a mission that has been in existence for almost a couple of decades by now. And they did come here to Jamaica about 2 years ago. We go to many different parts of the Caribbean and Central America. This year we're planning to go to Haiti, for example, where we try to perform the mission work and use our talents to help those who are underserved in those countries. So it's quite a natural thing for me to come here, and it's a pleasure to be here. I hope to be able to accomplish and help Trevor with what he's trying to do in improving the health. We'll be screening some of the athletes here. And we are looking specifically to see if they're at risk for any catastrophic heart disease. So that has been my role so far, and I'm enjoying it.
Clearly, just a moment, we need to take a break. I know you just slipped out because you're in the middle of the work. So let's just take this break and come back in just a moment. 26 minutes to 5 o'clock. Do you know where your children are? Are they where they're supposed to be? Doing what they're supposed to be doing? It's a good time to check up on the children. Well, if your children are student athletes at St. Jago, they're right here at the Knutsford Court Hotel. They are participating in this One Love, One Heart program, which is led by JAHJAH, that's Jamaicans Abroad Helping Jamaicans at Home Foundation, JAHJAH Foundation, partnering with Team Jamaica Bickle, the Inter-Secondary School Sports Association, ISA, and Jamaica International Female Football Development. We've been speaking with the founder and CEO of JAHJAH Foundation, Dr. Trevor Dixon, and Dr. Trevor Atherley, cardiologist at Newark Bethesda, is it? Newark Bethesda, Israel, Beth Israel for short, in New Jersey, Beth Israel. And he's also a member of the Caribbean Medical Mission. And he's involved in so many aspects of areas of volunteerism and just lending support to Caribbean people. He's from Barbados, but his heart is right here in Jamaica. But wanted to ask you as well, Trevor Dixon, there are other activities that you've been doing outside of the screenings and the monitoring and the educational information that you've been sharing with the student athletes here at the Knutsford Court, and will be doing for the next couple of days.
Yes, well, I can just run down the agenda. Tonight we're actually going to be at Uptown Monday, a project we call Healing in the Dance Hall. And basically we're going into the dance hall, trying to reach that population of that's vital, energetic part of our population. And we're going to teach them about diabetes, hypertension. We're going to offer HIV screening within the dance hall. This is not the first time we did it. The first time we did it, we had a little bit of skepticism of why we were doing it, but those patrons enjoyed it. We created awareness for those patrons in the dance hall. So that's tonight. Tomorrow we'll be back here doing some more screening. We have another school. We have Very Technical that will be coming in, and we're going to try to take a look at some of those athletes that they deemed at risk for any kind of cardiac issues. And on Wednesday, we're going to be hosting the Pediatric Cancer Conference here. It's the second time we're going to come and hold a Pediatric Cancer Conference, where Bustamante Children's Hospital will be coming together with Columbia University out of New York City. And they're going to be tackling some of the issues in pediatric cancer and some of the challenges here in Jamaica and in the Caribbean with pediatric cancer. So that's on Wednesday. And the group is going to break apart on Wednesday, and there's the group that's going to go down to Manchester at the Hanbury Home in Kendal, where we're going to be doing some much needed renovation. We're helping them build a sick bay. And if you go there today, you'll see that there's people pouring concrete down there trying to get the project ready and get it to the point where, you know, our volunteers can go down there, do some painting, and try to uplift these children. These children don't ask for anything, but I don't mind giving it to people who don't ask for much, because I know what they deserve as human beings. And we try to instill dignity back into these people and try to let them know they're not alone in this fight and to survival.
Mm-hmm. I'm going to come back to you to ask, how are you able to do all of that? Because we all know it takes cash to care, as Edward Siaga reminded us some years ago. But Dr. Trevor Atherley, just generally, what has been your experience so far as you've been interacting with the student athletes, doing the necessary checks, speaking with them, and so on?
Well, it has been somewhat limited since we've only just started, but I expect to see a significant number of students from several of these high schools here. While we understand that the yield may be quite low in being able to elicit and to pick up significant cardiac disease in these young athletes, it would be extremely rewarding if indeed we were able to forestall any dire cardiac events by merely picking up the potential for any of these students to have sudden cardiac deaths. So hopefully we'll find none, but if we do, we should be able to help in preventing such sequelae. This is a little different experience for me, since we are essentially doing quick screening and preventative aspects. And on most of the missions that I do go with, I've done over the years with the Caribbean Medical Mission, is actually been therapeutic, where you see people who have established illness, and we carry our own medications, and we take care of them, we treat them there, leave them medications to continue the work that we started. And they're often given eyeglasses by ophthalmologists, given dental work by dentists who are associated with us. And we try our best to take care of segments of the population, many of these underserved areas throughout the Caribbean and in some parts of Central America. This is a little different. This is preventative in athletes, most of whom I hope are extremely healthy and not at great risk.
Mm-hmm. Are there some signs we could look out for generally that might indicate to us that a student athlete might have an issue cardiac related, or it's not that easy to detect?
It's not that easy, but there are certain symptoms that they may complain of that may be a bit of a warning to us. Some of the symptoms, there might be a family history of sudden cardiac death, sudden death from heart disease, which could also be borne by these children. And of course, when we screen them, we look at certain specific characteristics on the electrocardiograms or on echocardiograms, which may give a clue as to the potential for sudden cardiac events.
Okay, just a moment. Let's come back to Dr. Trevor Dixon now. To do all this work, I mean, volunteerism does help a whole lot in terms of saving some money and benefiting from world-class services, but you still need money. How are you able to do what you've been doing and will continue to do as a foundation, JAHJAH Foundation?
Well, Dervan, is a very good question. I thank you for asking that question, because it gives me the opportunity to let folks know that it's not cheap, okay? And we're oftentimes in a hole, okay? The volunteers that come with us, we ask them to dig deep into their own pockets, and many of them are not Jamaicans, okay? But this mission is kind of difficult because the volunteers put out a lot of money. They invest a lot of money to be here. We can't afford to pay to have them come for free, and they put a lot into it. So if you look at these volunteers that come with us, please just tell them thank you, because it's very difficult. They have their families. Some of their children are in school. They have to leave their family time away, not just money but time, and they come. They don't complain, and they give their heart to Jamaica. So it's a good question. We need more support. We need more sponsorship. Tropical Blue Waters is one of the only sponsors that we have here. Tropical Blue Water from out of St. Elizabeth. And it's a shame that such a product, we don't have more people who are saying, hey, you know, we like what you're doing. We think you're doing a good thing. Here, you know, here's to help to pay for the hotel. We did an ultrasound conference this morning. It's going to happen again tomorrow. For the doctors in the public sectors, Kingston Public Hospital, we're training these athletes. These athletes, they're young. We're training them to do CPR. Because the truth of the matter is, if one of their colleagues, one of their schoolmates collapses on the field, the studies show that one of the best intervention is CPR on the scene. And we're teaching these athletes, I'm bringing on physicians to teach these athletes that CPR is what's going to help to make a difference in bringing somebody back from a sudden cardiac events many times.
Mm-hmm. Oh, why do you do what you do, Dr. Atherley?
Well, I certainly have a feeling that we should give back. We give a lot in life as physicians and as people, and we do deserve to help others as best we can. Mm-hmm. Therefore, I try with whatever abilities I have to utilize these in many different ways that I can, in teaching as well as in practical aspects of treating patients. And I'm especially heartened by the responses that we get from underserved populations throughout the Caribbean. Mm-hmm. So it is gratifying. I feel as though we're making a difference, and that is why I volunteer to do such.
Well, we want you to get as much help as you need, Dr. Dixon, along with your team in terms of sponsorship and support for your fundraisers whenever you hold those. So I want to give you an opportunity now just to spell out the contact details for JAHJAH Foundation and just tell those listening to us at home and abroad how they too can help JAHJAH Foundation to help Jamaica and Jamaicans.
Yeah, first let me say, I know there are a lot of organizations out there that people are skeptical about what their intentions are, you know, but JAHJAH Foundation is the real deal. And I say to yourself, to whom much is given, much is expected, okay? And as Bob Marley says, and I know you know Dervan, because I listen to your program a lot, Bob Marley said, if my life was just for myself, would it be worth living? You know, my life,
it's for everyone.
It's for everyone, okay? And if all of us took that attitude, we have children to go through school, we have college education to buy, but how much does it really take for us to reach in our pockets and give to those who don't have? Give to a foundation that has proven to be effective within the community, not just in Jamaica, but wherever the need is.
That's right. So the website address, Facebook, I mean, can they donate? Is there like a donate button on the website?
Yes, there is. Visit JAHJAHfoundation.org. That's JAHJAH Foundation.org. We're on Facebook. You can like us on Facebook. Put your comments down. but more importantly, visit the website also at JAHJAHFoundation.org. Hit that donate button, and we'll take anything of your donation. It helps. It helps to pay for the hotel. It helps to pay for the water for these athletes that come through here. We need your support. We can't do it by ourselves. You are JAHJAH Foundation. Whether you believe it's a Rasta or not, you are JAHJAH Foundation.
That's right. Irwine, Clare, you wanted to just support what Dr. Dixon was saying.
Yeah, I just want to indicate that Dr. T mentioned about the organization and trust again and something about the organizations. Well, JAHJAH Foundation is an endorsed organization in the diaspora. And the fact that Team Jamaica Bickle partners with our international female soccer players partners demonstrates that. What I'd like to also share with those who are listening who may have a propensity and a capacity to sponsor, understand that when you partner with organizations like this, it goes a far way, because you would have been buying into a system, a proven system, and a system that has a lot of, as far as part of its collateral, a whole lot of humanity, and the benefits are significant. And we've seen organizations in the past that have partnered with Team Jamaica Bickle and where they are today. And one such is Grace. Today, Grace is the premier sponsor at the Pen Relays. Right? So we're saying here to other entities here in Jamaica that has an interest in the diaspora and are looking to penetrate your market, and you want an angle and an opportunity to do so, organizations like JAHJAH Foundation, organizations like Team Jamaica Bickle, and the other partners with us today are entities that you should be looking at. Okay. So that is my thrust to my population here in Jamaica, where we reach out for support for entities, and this is what we do today.
Great. Thank you so much. And well, oops, look at the time. I'm going to allow you to get back inside. Thank you very much, Dr. Dixon.
Thank you for having us here. Remember, JAHJAH Foundation and Team Jamaica Bickle, along with the Caribbean Medical Association and the other sponsors. Tropical Blue Waters, we thank you for your support.
And thank you too, Dr. Atherley. All the best.
Thank you, Dervan.
Okay, good. Take care. So there you have it. Dr. Trevor Dixon, founder and CEO of JAHJAH Foundation, and Dr. Trevor Atherley, cardiologist at Newark Beth Israel in New Jersey, and Caribbean Medical Mission member. We're at the Knutsford Court Hotel.